Hey everyone, hope you all are doing well. As we start this new week, we're going to be talking about international population health. We're going to be talking about global health disparities. Got a lot of interesting stuff to talk about today and this week. So I just want to frame today's class session, just again, reinforcing population health, introduction to population health. I want to emphasize that health disparities and how health disparities are profoundly influenced by factors beyond your individual control, by individual decision-making processes. So things like economics, politics, social structures. These things are really important in how we look at population health, like we've talked about in nationally, but also externally and internationally. So we also want to look at global health disparities and want to think about those things as unequal health outcomes across different countries and population. That's our focus. When we talk about global health disparities, it's looking at health disparities and disparities in terms of health-related outcomes across different countries and different populations. So I want you all to consider as we go through this class, what factors do you think cause health disparities between countries? I really encourage you to think about those economic, structural, and political aspects, not just on a national level, but on a global scale. So those are the things we're going to talk about. So again, some key terms I want to introduce. So one, global health disparities. What we mean by this is we're referring to the unequal health outcomes resulting from differing social, economic, and political conditions across countries. Another term I want to introduce, international population health. This is a field that examines health outcomes and their distribution among global populations, often focused on developing regions and more marginalized countries and communities, even within those more marginalized regions. Those are the things we're looking at a global scale. In the notes, you'll also find some detailed reading summaries, but I'm going to be talking mainly about Barkin Chapter 6, the O'Laughlin 2016 readings. Then we have a couple of films and documentaries that we're reviewing for today, the AIDS in Africa and Inside Yemen piece. There are also the Cochrane readings that give a good preemptive component here. So let's talk about some introduction to international population health and global health disparities. So again, I framed what international health is, these kind of key terms, right? What do we mean by global health disparities and international population health? Those definitions are there up on the screen now. And just to give you a quick summary, I think will be helpful, just a quick summary of these readings to start. The Barkin chapter looked at how disparities in health are shaped by social factors. And really, they had an emphasis on differences in access to healthcare. A different in access to healthcare and to income and different living conditions. Barkin also highlights that health outcomes are influenced by both personal and societal factors and really gave this foundational perspective on why health disparities exist, both within and between countries. So Barkin gives you a really great overview of what this is. O'Laughlin, the 2016 O'Laughlin reading, this article critiques the focus on structural reform in global public health efforts. And largely, these structural reforms that fail to address the political and economic inequalities underlining poor health outcomes. And O'Laughlin argues in the article that without challenging these root causes, remember upstream versus downstream approaches, really focusing on those upstream root causes approaches. Health interventions often remain limited and ineffective, and particularly in these impoverished regions, that we need to take the same sort of population health perspectives that we've talked about in previous classes, right? Those upstream community-focused efforts into a global perspective as well, and make sure that that is something we're considering quite in depth and quite foundationally. And then there's the two videos as well, the AIDS in Africa one and the Inside Yemen. And the AIDS in Africa documentary presents the complex factors behind the AIDS epidemic in Africa. And really what that documentary does, it shows how the disease's spread was exacerbated by poverty and inadequate healthcare and limited international support. And the film contextualizes the AIDS crisis as both a medical and a socioeconomic issue. Again, think about it when you watch these things from the perspectives that we're building, those social determinants of health, upstream, downstream, those sorts of things. And then the Inside Yemen film what that does, that provides a nice real world look at health consequences of conflict, documenting the devastating impacts of war and political instability on Yemen's health system. And it also underscores the limits of medical interventions in regions where basic resources are scarce, and really emphasizing the need for political solutions as well when it comes to public health. So that's just an overview. Let's get into them a little bit. So national versus global health disparities. So here, thinking about Barkan again, discussing health disparities within and between nation, and highlighting how access to resources, healthcare infrastructure, socioeconomic factors, these things lead to varied health outcomes. And what Barkan's chapter does, it provides insights into how both national policies as well as international inequalities shape health on an individual and also global community scale. And so while national health disparities often focus on inequalities within a single country, global health disparities look at differences across countries. So this understanding that both we need to understand that both perspectives is essential for a comprehensive view of population health, because we've talked about within our national communities within, say, the United States as many examples in previous sessions of this course. But now we got to take, if we want to think fully population health, think beyond the United States, broaden our perspectives, think globally. Now we have to take those same sort of thoughts. Now we know how to think internal to a country. Now let's think about how do we think disparities across macro level countries and institutions like that. So national health disparities, again, focuses on, I want to talk about both here. National health disparities focus on inequalities within a single country. And these disparities are often tied to socioeconomic factors like the social determinants of health that we've talked about: income, education, race, ethnicity, gender, geographic location. And these things influence access to healthcare and quality of care and overall health outcomes. So, for example, in the US, differences in life expectancy between racial groups highlight systemic inequities in access to healthcare and exposure to social determinants of health like housing and education and employment. Now, global health disparities, on the other hand, examine health inequalities across countries and across regions. And these disparities stem from variations in resources and variations in healthcare infrastructure and systemic issues like colonial legacies and trade policies and global economic inequality. So, for example, countries with more limited resources tend to face higher rates of preventable diseases, things like malaria and cholera, while wealthier nations can afford more advanced treatments and preventative care, and treatments even for chronic conditions like cancer and diabetes, those sorts of things. And there is this interconnectedness of national and global health disparities that's also important to discuss. So while these categories are distinct, like I just talked about, they are also interconnected. So, for example, global health inequalities influence national disparities within countries dependent on things like international aid or trade policies. So many of the same factors like poverty and political instability and systemic discrimination, these things do contribute to disparities at both levels, but their scale and solutions vary. So the scale and solutions at the national level versus the global level do differ, although they are having similar impacts. And so a relevance to population health here. So it's important to highlight that addressing disparities at the national level often requires systematic changes like improving healthcare access and tackling social inequalities. On a global scale, solutions require collaboration between nations, international organizations, and NGOs to address larger systemic issues like economic inequality, like disease outbreaks, like access to affordable medication. How we go about addressing these issues are different at both of these different levels. So again, be thinking about what are some examples of health disparities that exist within a single country, like those we've talked about prior, and then how are they similar or different to those seen between countries? This is stuff you can include in your discussion prompt for today. Why is it important to consider both national and global perspectives in addressing health disparities? How might global factors like trade policies or international aid impact health disparities within a specific country? These are things you're going to have to think about, and I really want you to consider. And so again, some key takeaways that I want you to have from this reading is that national health disparities focus on inequities in a single country, influenced by those internal policies and social determinants of health. Global health disparities, on the other hand, examine inequalities across countries, shaped by broader systematic factors like economic inequality and global power dynamics. And then addressing these disparities requires targeted strategies at both national and international levels. Okay, let's get into the Cochrane readings. I may have to change these up a little bit on the Moodle page. Just need to double check a couple of things. So if some of these things don't look particularly accurate, I want to make sure I was going off the same version as you that I uploaded. But what I want to talk about here in these readings is health inequalities, health services in developed nations, and then health services in developing nations. So health inequalities. So let's talk about that first. Here, Cochrane is examining health disparities within and across countries, focusing on those socioeconomic factors like income, education, and occupational status, and really focusing on the intersectionality of inequality and showing how these multiple disadvantages build up and collaborate with each other, like poverty, race, and gender, and these compound poor health outcomes. And so this Cochrane can provide a good foundation discussing national health disparities, such as those observed in wealthier nations. And so let's get into health services in developed nations. So a key focus here is that we're analyzing healthcare systems in developed nations, including public, private, and those hybrid models altogether. So Cochrane here discusses how access to healthcare and cost and government policies impact population health outcomes. And this chapter provides insights into those singularly national health disparities by examining how healthcare delivery varies even within high-income nations, influenced by political ideologies and funding mechanisms. It also serves as a comparison point for those global health disparities, as the healthcare systems of developed nations starkly differ from those in developing nations. So I want to highlight how these variations in healthcare systems, things like universal healthcare in the United Kingdom versus market-driven healthcare in the United States, these things can contribute to different health outcomes both within and between countries. So think about what I want you to think about is considering the impact of healthcare access on chronic disease management in the U.S. versus Canada. Things like how more affordable healthcare systems can allow us to afford more preventable visits and treat chronic conditions better. Whereas in the United States, we have a very significant issue that is continuing to grow on chronic diseases like diabetes, those sorts of things. And then I also want to mention how Cochrane talks about health services in developing nations. So Cochrane explores healthcare systems and challenges in developing nations as well. So things like underfunded infrastructure, a lack of trained professionals, and dependency on international aid. And he discusses how global health initiatives and the role of organizations like the WHO and various NGOs in addressing healthcare deficits, how those things work and what that system looks like. And so what I really want you to think about in terms of how this aligns with global health disparities, Cochrane's explaining how low-income countries often face far worse health outcomes, and looking at systemic factors like political instability, for example, or economic inequality and colonial legacies, how these structures are deeply rooted and they perpetuate health inequalities. So think about barriers in healthcare service delivery and developing nations in the role of global partnerships in addressing these challenges. How do nations like the United Kingdom or various European nations or the United States, how do our healthcare systems impact those healthcare industries at a global scale? And so for an example, the impact of programs like Gavi or the Vaccine Alliance, how has that improved immunization rates in sub-Saharan Africa? So these non-government organizations, these NGOs, play this key role on the international stage in terms of addressing population health and public health issues at the international level. So make sure that you have an understanding of at the global level, not just what global disparities look like, but how do we address global disparities? Because it's not as simple as United States implementing a new policy, because that jurisdiction, that reach is not there. So it's other factors like non-government organizations and the WHO, the World Health Organization. We have to understand how these folks have that reach across an international level. So there's some discussion questions, some other key takeaways in the notes here that I encourage you to look at. Structural inequality and global health. This is the O'Laughlin reading from 2016. So I want to go over some big key takeaways from this reading as well, because this is an important one too. And so here, O'Laughlin critiques global public health initiatives that tend to focus on medical interventions or structural reforms and these are really those downstream efforts. What he's critiquing is that they're not including the addressing of root causes of inequality. So again, the same sort of critiques that we have at the national level of these downstream approaches addressing the symptoms, but not the root causes, which would be the upstream approaches. Laughlin has those same critiques of global health initiatives as well. And so O'Laughlin argues that while efforts to improve public health are essential, they often fall short because they fail to examine and resolve those underlying social and economic and political conditions that perpetuate inequality and poor health outcomes. So the article critiques piecemeal reforms and those specifically that target health issues, but don't consider the broader political and economic context of the specific regions or the populations they're actually aiming to help and implementing it. So what the paper does, it emphasizes that to truly improve global health outcomes, reforms must not just address immediate medical needs, but also those structural inequalities that drive health disparities. And what's also discussed in the article is the extra difficulty, the degree of difficulty that, especially on the global scene. So it's not as simple as just implementing a new policy, say the United States implementing a new policy, or the WHO can't just go into a country and implement structural reform. We can pretty much, those downstream efforts are much more feasible. Those downstream approaches of addressing symptoms, not the root causes at the global scene. So that's why we need to make sure that we're including, when we design initiatives like this, we're including people at that level. We're including people in the discussion of how do we actually design, not just implement these interventions to have more upstream efforts. So the key takeaway from O'Loughlin's work here is that is on the connection between structural inequality and health outcomes, and that it's important to emphasize that global health initiatives focus really only on providing medical solutions like vaccines or healthcare interventions, and how these things might fail because they do neglect larger forces shaping those health outcomes. So think about things that we've already talked about, like poverty and lack of infrastructure and political instability, how these things impact public health outcomes. So, for example, improving health outcomes in regions with high levels of poverty and weak political governance requires more than just providing healthcare services, right? It requires addressing the economic and social policies that perpetuate those conditions. And without doing that, medical treatments may not be sustainable or may not have the desired impact, as people may continue to live in environments that exacerbate their health challenges. So we should really highlight here that many global health initiatives, though well-meaning, right, can sometimes be overly technical or focus too much on short-term fixes without addressing those long-term systemic issues. To really make a difference sustainably, we need to address those long-term systemic issues. So think about why a purely medical approach to health might be ineffective, right? And that seems almost counterintuitive at times, because there are things like malaria and AIDS in Africa that do require those right now medical interventions, absolutely. But we need to think critically about how healthcare is shaped by broader social and political forces. And really, I want to challenge you to consider that the social determinants of health, things like income inequality, access to education, and political freedom, they must be a part of any effective global strategy. So there's some other key takeaways there. That structural inequality is connected to health outcomes. We know that, we've talked about it, but those things related to race, class, gender, and geography, they significantly impact the health of populations. And these inequalities result in unequal access to resources such as healthcare, education, nutrition, and safe living conditions. So, for example, marginalized communities often face challenges like underemployment or poor housing and lack of healthcare access, all of which contribute to chronic disease and malnutrition and premature death even. A deeper understanding of these factors is really critical for more effective global health interventions. In the same way, it's critical for effective national health within national health interventions. Number two, that a purely medicalized approach is insufficient. While medical solutions like vaccines and treatments and healthcare infrastructures are essential, they often fail to address those social root causes of health disparities. So simply applying medical interventions without considering the underlying political and economic issues oftentimes will lead to temporary fixes or even worse inequalities in the long run. So for instance, antiretroviral drugs can absolutely and do extend the lives of those living with HIV, but without addressing issues like poverty or stigma around that disease and gender inequality, these medical solutions may not actually be sustainable, or they may face implementation challenges. Who actually gets it? Who is actually going to seek out these treatments or have access to these resources? Finally, number three, effective reform must address the social determinants of health. Again, we talked about how that's going to be a through line through the entire course, and it has been. Because O'Laughlin here advocates for health reforms that do more than just treat diseases, right? They should also tackle the social determinants of health. Things like we've already talked about over and over again, like income inequality, access to clean water, education, political empowerment. These global health initiatives must consider more holistic approaches that improve these broader conditions to ensure that health improvements are more long-lasting and more equitable and sustainable, because it costs a lot of money, these implementations. So creating them as more sustainable and more root-causing and upstream approaches, these things are going to be more sustainable in the long term. So for example, a program to reduce malaria in sub-Saharan Africa might provide bed nets to reduce transmission. But if the area also lacks access to things like clean water or adequate sanitations and public health infrastructure, that initiative may only achieve very limited success, because you need to address these broader root causes to be much more sustainable and long lasting. So that's the O'Laughlin reading. That's really O'Laughlin is a really good reading for this specific session, because it encompasses all of the things we're really talking about and provides some really good concrete case studies. And speaking of case studies, we're not going to watch these videos here in this recording session because that's you can do that on your own time. And should do that on your own time. But the AIDS in Africa film is one of the two videos that we were to watch for today. And so I'm just going to give a brief summary, but I want to make sure that you watch this film. And what this looks at is the film examines the factors that contributed to the widespread impact of AIDS in Africa. And these things include poverty, lack of infrastructure, and inadequate international support. And what the film does, it also highlights how the social and economic inequalities amplified the impact of the epidemic. I really want you to use this case study to think about how health crises can be intensified by socioeconomic conditions. So for instance, poverty can limit access to treatment and prevention resources, while stigma and inadequate healthcare infrastructure exacerbate health outcomes. So really think about how this aligns with the concepts of structural inequality that we just talked about in the O'Laughlin reading as well. So this is another really great example of that. So think about those things. And just a couple more key takeaways is that AIDS in Africa is an example of how a health crisis can reveal and amplify pre-existing social and economic inequalities, and also that effective health interventions require more than just those medical responses. They need the structural, social, economic support, things like resource allocations. Those are the things we have to think about in a more long-term or longitudinal way, not just a cross-sectional, not just the here and now. Let's treat the symptoms or the effects of the disease, but let's treat the actual upstream root causes. So the second case study that I want to talk about, the other video that you all were assigned, is the PBS health crisis in Yemen. So just as a quick summary of this video. So inside Yemen, what the film does, it documents the humanitarian crisis in Yemen, where political instability and war and poverty, these things have led to severe health challenges, including issues of malnutrition and issues of cholera outbreaks and a shortage of medical supplies. And the film showcases how health outcomes are deeply, deeply affected by non-medical factors as well. So the case study reinforces the role of political factors in health disparities. And I want you to make sure that you understand how that in Yemen, health is inseparable from conflict and economic decline. You cannot make that distinction when we look at this from a public health perspective. Cholera and malnutrition are not just medical issues. They're symptoms of larger political and economic crises. And things like political instability and war and those sorts of things and poverty, they have that direct impact on health outcomes for a population. So again, health inside Yemen, just to discuss it a little bit more, it provides a really great firsthand look at that devastating humanitarian crisis in Yemen. And this has been fueled by years of war and political instability, economic collapse. And the documentary follows the impact of these crises on health, showcasing widespread malnutrition, cholera outbreaks, and the collapse of Yemen's healthcare infrastructure. And the film also highlights really well how these non-medical factors like conflict, poverty, and systematic breakdowns exacerbate these health issues. Maybe some of these health issues surely exist before, but how this both exacerbated and maybe even created new health challenges. So these challenges far extend beyond the scope of traditional medical care. We have to understand that from a global perspective, that are within national ways that we address public health crises, that it needs to be scaled so differently at the global scale. Yes, we need to consider the social determinants of health, but we have these other structural components at the international level that are really, really key to understanding how to address this. So the documentary is really a powerful illustration of how these political and economic inequality really drive these health disparities. And in Yemen, preventable diseases like cholera, they're not just public health challenges, but again, indicators of broader political issues and broader humanitarian crises occurring. And so I wanted to use this documentary, I want you to use this documentary to emphasize how sustainable health solutions in these sorts of contexts, these international contexts, really require addressing those underlying political and economic conditions. That's the big takeaway here. So we need to make sure that we understand how these political instability, economic decline, that they're really critical factors in health outcomes of populations, especially in like Yemen, in these conflict zones, in these international conflict zones. And addressing health crises in areas like this requires much more than just medical intervention. We're not downgrading or degrading medical intervention. Those are critical, but we need to also address political solutions and support for rebuilding healthcare and economic infrastructure. Those are the things that we oftentimes don't think about public health. We think, well, do you have medical, do you have medications? Do you have doctor resources? Do you have these sorts of resources and access to that? We need to think more broadly and more critically that there are also these broader political and economic solutions that we need to solve in addition to just treating for medical in medical ways and with things like Doctors Without Borders and providing medications. We need to think also more broadly. Just a very quick wrap up in synthesis here. So I just wanted to give 3 key summary points for the day. So the key summary of the day is I want to make sure that you all understand these things. So number 1, that health disparities exist both nationally and globally, and they often stem from similar foundational impacts like social, economic, and political inequalities. We need to understand that. But that these things appear differently. So disparities at the national level and at the global level are scaled quite differently. And again, to reemphasize the Barkan reading, nationally, we're looking at the things we've talked about in the previous weeks. Globally, we're looking at disparities, how health outcomes within this nation compared to another nation, how there are disparities there, and that we still need to look at more root causes, not just from individual perspectives, but at these global levels of how we impact them and the same sort of social, economic, and political inequalities that do exist at the national level, or at the global level, rather. Number 2, so structural reforms in global health often overlook the root causes of health disparities. And what this does is it limits the effectiveness of interventions. Remember, we have to think constantly those upstream efforts rather than those downstream approaches that just only address the symptoms and the effects of diseases. We need to make sure that we're taking those upstream efforts and we are addressing the root causes. The same goes for global health disparities as it does for national, but it looks differently. And then finally, case studies like the AIDS in Africa and the health crisis in Yemen videos, the films and documentaries there, they illustrate how health issues are often compounded by structural inequalities and that effective solutions require addressing these broader issues. So that's what I want you to take away. These key aspects I want you to take away from today, that what it means when we're looking at global health inequalities, how we look at those things. Make sure you watch both of those videos as really good solidifiers there. And then just as a reflection question, maybe you can include something to this extent in your discussion prompt for the week. How can we apply what we've learned today to design more effective public health strategies? Be thinking about that, because you as potential future public health practitioners need to understand all of these impacts. And understanding the global scale will also help you to understand our national how do we address these things at a national level, and the inverse as well. How we understand how we address these things within nationally is going to help us to address things at the global scale. So please let me know of any questions that you all do have. As always, happy to meet one-on-one like we have been. Please let me know of any questions. Really looking forward to seeing your discussion prompts for this week, and we will talk more very soon.